Hi, I'm Dr. Sasha Obey, the Medical Director for North Texas Plastic Surgery. And I'd like to take a minute today to visit with you about a topic I feel is extremely important: preventing breast implant infection. Anytime a surgery is performed, there is going to be a risk of infection. Our goal at North Texas Plastic Surgery is to minimize your chances of any infections developing after your breast augmentation. We have developed a comprehensive approach where we try to fight infection before the surgery starts, in the surgery, and post-operatively to prevent you from having any problems during your breast augmentation recovery. As I said, the fight against infection starts before the surgery even begins. We're actually going to prescribe you a prescription strength soap that we're going to have you wash with the day before the surgery. This has been shown in studies to decrease the amount of bacteria that is naturally living on your skin. By decreasing the amount of bacteria that you walk into the operating room with, we know that we can decrease the rate of breast implant associated infection. Furthermore, before we even wash your skin in the operating room, and before we even begin the surgery itself, we're going to give you an antibiotic in your veins so that any little bacteria that happens to get into your bloodstream during the surgery will be up against a strong foe which can help fight it. Furthermore, we're going to wash your skin on the day of surgery with another prescription strength, long-acting antibacterial soap to decrease your risk of infection. On top of that, we are going to cover your nipples with an occlusive dressing. There have been multiple plastic studies that have shown that bacteria actually live in the ducts and in the skin of the nipple. By covering the nipple with an occlusive dressing, we know that we can decrease the bacteria that is exposed to the breast augmentation surgery and to the implant, and thus decrease the rate of infection. Furthermore, before we place your breast implant, we are going to wash the pocket that we create for the implant with 3 different antibiotics, which are different than the antibiotic soap that we're washing your skin with. They're different than the antibiotic we're giving you in your veins, so that we are hitting this bacteria with all sorts of antibiotics from multiple angles to try and prevent any infection. Beyond that, we're going to close your skin with a special glue which is impermeable to water. This glue, known as Dermabond, prevents bacteria from getting into the wound post-operatively and thus decreases your rate of infection. Finally, we're going to place you on an oral antibiotic that you're going to take for 5 days after the surgery. In case there are any bacteria that somehow manage to slip through all of these other measures, they're going to find a strong antibiotic in your system to fight them. By taking specific, very proactive steps prior to the surgery, in the surgery, and after the surgery, we feel confident that we can give you the safest breast augmentation experience.